Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and this video is going to be part of the flexor tendon protocol and rehabilitation series that I'm finally getting to after years and years and years of people requesting videos and me just being terrified to broach the subject. So yay, we're finally here. Welcome to it. And today's video, I would like to go over some ways that you can choose a protocol, or basically how to choose a protocol. So in choosing a protocol, I think the number one thing is knowing your surgeon and their preferences. And sometimes you don't know their preferences because you don't know them and they're new to you. Sometimes you don't get very much information from them, which is really frustrating and annoying. And sometimes things get lost in transit, like op notes and stuff like that. Sometimes they just don't get back to you, and it can be a really big pain in the neck. But do your best. Try to talk with the surgeon in advance. Try to get a sense of what their preferences are in general, what their preferences with this patient. Knowing what complications arose during surgery. It's really important to know if the amount of sutures, right? Like, did they have a 4-strand or a 6-strand or a 2-strand? Because that's going to depend on, or that's going to influence your decision for delayed motion versus early active. You want to know their age. You want to know if they're, a child. They're probably going to be more like delayed motion or immobilization, or maybe the surgeon's casting them or whatever, versus, somebody that's able to follow instructions or directions. You want to know if they have any cognitive issues or decline, or memory loss, or anything that might influence their ability to follow your instructions. And you also want to know, sometimes the mechanism of injury can tell you a lot also. Not just if it was like a clean or a jagged cut or whatever, but also like how it happened, to tell you, is this person like kind of impulsive, or maybe you don't trust them necessarily to make good decisions, or that they don't necessarily follow instructions, or that maybe they're like a really big risk taker, or was it just like kind of a freak accident kind of thing, which a lot of times it is. But sometimes there are patients that their mechanism of injury will kind of tell you like, I'm not sure that I trust you so much. So all those things are going to kind of, influence your decision-making skills. And so those are important things to have the information on as well. It also helps if you know where to look to find what different options are there, because there's about 8 billion different kinds of flexor tendon protocols, and they're changing all the time. I think that there's so many different ones out there, and it's really helpful to have a few kind of solid options or solid starting points, essentially. I tend to combine elements of multiple protocols because I think that the protocols are there as guidelines, not necessarily as a rule book. So I don't know if other people practice that way, but I just don't like the idea of being stuck to one specific protocol, unless you're doing research. Obviously, that makes sense. But, there's basically two main categories. There's sort of the delayed motion, right, which is going to be sort of the early passive motion or immobilization type protocols. And then there's going to be more the early active type protocols, where you're starting active movement earlier on. But it helps to know kind of some ideas of where to look, some references. Some of the ones that I like to use are the Indiana Hand Center Protocols book, which is a really great resource if you don't have it in your clinic, or if you don't have it at home. I do recommend getting it. I think they have, the new version is honestly so awesome. I'm really, really happy with what they put out a few years back now, and it's just super helpful for so many multiple things. But that's a really good resource. The book by Elizabeth DeHerter, it's a protocols book. I cannot remember the name of it for the life of me right now, and I don't have it at home. I like keep my copy at work so that my colleagues can use it too. But I will look all these up and list them below so that you have the correct names. That's a really nice one too. She has a lot of more less conservative protocols, which is kind of nice to have some simplified ideas of some less conservative things. Their Brigham and Women's has some really nice, very clear like grids that you can look at for different zones of tendon injury, and so that's always a really good resource too that I recommend to new grads as well, because it just has a really nice format and guidelines. It's easy to use and easy to follow. And they also show progression, which is really nice too. There's also some of the, the newer protocols coming out with the Wallant and the, Manchester short splint and all these things too. But at least having kind of a base starting point, I think, is really helpful. And then you can kind of experiment or progress as time goes on and as you get more comfortable with your surgeon and they get more comfortable with you as well. I don't know if this is an unpopular opinion or not, but I also think that one of the factors in choosing a protocol is dependent on your clinical skills as well. And knowing where you are in your clinical skills, and if you have mentorship or support, or if you're the only hand therapist at a clinic, your answer might be a little different. A lot of the protocols, like if you're going to follow a specific protocol very strictly, a lot of them have these really complicated splints to make, that I'm sure I could figure out how to do it, but honestly, I'm not confident, and I already sweat so much when I'm working with a tendon repair. Like, there's already so much on the line. I think that the patients already have a hard enough time managing just a static orthosis. Like, I'm just not convinced that making a really complex dynamic orthosis is best in all cases. There are probably cases where it is truly best, but a lot of those early active protocols will recommend sort of like the hinge brace or like, just all these different components. And I don't usually have enough time to make that. Like if you have unlimited time in your clinic and you have all the time in the world to make multiple splints for someone, amazing. I wish I had that. But also, I think it's really fiddly and hard for the patient to manage. The few times I've made dynamic orthoses for like extensor tendons, for instance, which is more common in our clinic, but still not very common, patients hate it. They can't get their sleeves over it. They're like afraid to touch it because they are afraid to break it. Like there's just so much that's challenging with a dynamic orthosis. And I'm not saying that they're bad by any means, because I know that they have a purpose and a place in therapy. But I don't know if I have the skills that I would be confident in to make a dynamic orthosis in every case, or a hinge orthosis, or whatever it is. And, I'm fully transparent with that with myself. Like, I know what I can do and I know what I can't do confidently or competently. And so for me, I always think that guides my practice a little bit as well. Does it mean that because I'm not making a dynamic orthosis that I'm not going to do an early active motion protocol with someone? No, it doesn't. It just means that I'm going to combine multiple parts of different protocols for what I feel fits the patient the best. So that's just my opinion, and I feel like I will take that to my grave, and don't come for me, but feel free to share your opinions below too, because I do like to hear from other therapists, like kind of what your preferences are and what you believe in and the way that you practice too. I think that it's really helpful for all of us to learn, and for me to learn too. But that's my take on it. Like I do not like dynamic orthoses for flexor tendons. Take that with what you will. I'm being very transparent and rambly today, and I apologize for that. But, we have to get real with each other. I think that's how we all learn, right? And support each other. And I am by no means the best therapist ever. I am better than I used to be, better than I was a week ago, better than I was a year ago, but I am growing and learning all the time, and I fully accept that I also am not perfect, and I don't know everything either. So yeah, I think those are kind of my main points on picking a protocol. I think, figuring out the patient factors, figuring out what the surgeon wants, or some complications of surgery, or, kind of the basic necessity things like epitendous stitch and 4-strand repair and all that kind of stuff. Super important. but also figuring out what the patient is going to be compliant with, also figuring out what you feel comfortable making and progressing them with, and then, you know, figuring out kind of what is going to be the best fit for the patient and for their care. So yeah, this was a very rambly video, and I hope that when I'm editing it, I don't feel like I need to delete it all. And but I think sometimes it's nice to just brain dump and share knowledge and information and thoughts with the world. So hopefully you guys feel that way too. Thank you for watching this very long and probably boring video. But again, I think a lot of us are kind of hand therapy nerds, so maybe it will be fun for some of you to get through to the end. If you made it this far, you are incredible. Comment flexor tendon in the comments below so I know that you made it this far, and I hope to see you in the next one. Comment below any future videos you'd like to see as well. Share any opinions with me that you like, and I will see you in the next one. Thank you so much for watching.